Research has shown that an estimated 354 million people around the world live with one form of hepatitis or another, especially type B or C. And for many, testing and treatment are inaccessible. While they all cause liver disease, they differ in important ways, which include modes of transmission, severity of the illness, geographical distribution, and prevention methods. However, types B and C lead to chronic disease in hundreds of millions of people, and both are the most common causes of liver cirrhosis, liver cancer, and viral hepatitis-related deaths. In the course of the program, you will understand all you need to know about hepatitis and the issues surrounding the gaps in the elimination process. We start with this background report. I am Uche Ugochukwu.
Hepatitis is a viral disease that causes inflammation of the liver. This inflammation can be caused by several viruses, chemicals, drugs, alcohol, certain genetic disorders, or by an overactive immune system that mistakenly attacks the liver, called autoimmune hepatitis. Hepatitis can be described as acute if it resolves within 6 months and chronic if it lasts longer than 6 months. Acute hepatitis can resolve on its own, progress to chronic hepatitis, or may result in acute liver failure. Chronic hepatitis, on the other hand, may progress to scarring of the liver, liver failure, and liver cancer. Viral hepatitis was previously described as epidemic jaundice and has been known to exist since ancient civilization. The contagious nature of the illness was suspected even in the 8th century AD. Epidemiological observations from research in the late 19th century, including human experimentation in the 20th century, led to the gradual identification of an infectious hepatitis agent transmitted by oral fecal transmission and serum hepatitis agent transmitted by inoculation or transfusion of serum, blood, or plasma. However, in the 1960s, the hepatitis B virus was discovered and further research to the discovery of additional hepatitis viruses. They are basically 5 in numbers: hepatitis A, B, C, D, and E. Hepatitis A is mostly a foodborne illness and can be spread through contaminated water and unwashed food. It is the easiest to transmit, especially in children, but is also the least likely to damage the liver and resolves within 6 months. Hepatitis B can be transmitted through exposure to contaminated blood, needles, syringes, or bodily fluids, and from mother to baby. Hepatitis C is only transmitted through infected blood or from mother to newborn during childbirth. Hepatitis D is only found in people who are also infected with hepatitis B. And hepatitis E is predominantly found in Africa, Asia, and South America. Common symptoms of infectious hepatitis are fatigue, flu-like symptoms, dark urine, pale stool, abdominal pain, unexplained weight loss, yellow skin, and eyes. Hepatitis viruses can transmit from person to person through contact with bodily fluids, water, and food containing infectious agents.
You're welcome to Global Health Digest. Let's find out from the street corner how knowledgeable the people are about this disease. And afterwards, a hepatitis survivor, Anton Basenko, will share his experience and hope for sufferers. Basenko is the program's manager, EU AIDS Treatment Group.
Can you tell us what you know about hepatitis?
Well, I think it has to do with sickness of the lungs. That's my own understanding.
It is a liver disease, and several types: hepatitis A, B, and so on and so forth.
The little I know about it is when I was seeking admission abroad, that's about 15 years ago. I went for medical tests, and they say I have hepatitis B. And that was all. And since then, I've been living healthy. I don't know. I don't have any medical undertone that I will say, okay, is it that same hepatitis I'm suspecting or not? I've not been having any problem regarding my health. So, and I've never specifically go to hospital and I say I want to treat hepatitis B or anything. No, that was all. And it's possible I have undergone some treatment that has equally solved that problem. I don't know.
The most important point is that I am a person with lived experience with hepatitis C. And I definitely know what does it mean to have timely, proper, affordable access to diagnostics, treatment, social support, etc. My hepatitis C has been cured in 2016, and due to my personal experience, I started to work in the public health field in HIV, tuberculosis, and viral hepatitis, especially in so-called harm reduction programs, because I'm a person also with drug use experience, and I'm a person openly living with HIV. So actually I have a number of different, I don't want to say issues, but elements of why I am so committed to the topic of hepatitis and to really motivate donors, governments, organizations to invest in hepatitis properly to fully fight it till 2030. Yes, it was not easy because since you opening your status, whether it's, I mean, of course it depends on the audience, but I mean, if it's just common people and it's not part of your, professional activities, and since you opening your status, or even people guessing that you are a person who use drugs or a person living with HIV or hepatitis, it radically can change the attitude. And immediately, you can even see how their faces are changing at that moment when they realize who are you and what's your background. But at some point, given that harm reduction programs, antiretroviral therapy, Hep C treatment, so-called opioid agonist therapy, all these elements of a health system, they saved my life. I decided that it's my certain mission to, bring this testimony, to live openly and to talk openly about these things, because I know how I could die many years in this life, and I know how many people, whether it's my friends or just people I could prevent from deaths or from problems I faced with in my time. My takeaway is that first, readiness among the donors and governments potentially interested in this investment, readiness is there. It's good that people here, at least from what we could hear from speakers, people really realize that money or funding as such is not a silver bullet, that there should be other factors, or let's say other values or principles of use of this funding to make it effectively and to really reach the goal of this investment of this funding. So, as we say, tools for hepatitis are there, like treatment is available, diagnostics, prevention like vaccines is available, but without reduction of stigma discrimination, changing punitive laws, discriminatory policies, without integration of models of care, and without, for instance, provision of proper access to specific programs like harm reduction for instance, people who use drugs, who is a key population for hepatitis C, for instance, around the globe.
To give credence to Besenko's statements, a WHO study found that an estimated 4.5 million premature deaths could be prevented in low and middle-income countries by 2030 through vaccination, diagnostic tests, medicines, and education campaigns. Good news, we say. Health financiers recently held a maiden high-level resource mobilization conference in Geneva, Switzerland, as part of efforts to eliminate viral hepatitis. Jare Road is the Executive Director of Hepatitis Fund. He tells us more about the conference, especially global efforts in bridging the funding gaps in hepatitis elimination.
I think for the rest of the world, there's been a lot of discussion on how to finance the gap in the elimination parts. Discussion has been between government and WHO, Global Fund, Gavi, everybody has been included in this discussion. So we said, well, someone has to start it, and who are better placed than the Hepatitis Fund in partnership with CHAI to initiate this and kick off a resource mobilization conference. I think for the commitment everyone did today, it gives us an immediate success. A long-term success, we'll see how we can continue and resource year after year. It's not only the immediate resourcing, it goes on year after year. We say, we have a slogan, say, and HAP 2030. It means that we follow up on the target under the Sustainable Development Goal number 3, a better health for everyone, to resource the elimination path. So this is just the beginning. If we go 10 years from now, we should have eliminated viral hepatitis. So I think that is the final success story when we can say we have done that. I want to think, and I work to think like that. I have to believe in it because that is my job. And I think with the effort we saw today that we can actually meet this success story because we have all the means available. During the day, doctors, head of organization, government representative, excellencies, they all said the same. We have vaccination, we have treatment, we have cure, we have test and diagnosis in place. There's nothing that prevents us from doing it. So it's only the government who has committed by signing the Sustainable Development Goal and signed up to the target in 2016. They have promised commitment, so they have to be there to make this successful. I think what we heard from many countries in Africa, in Asia, and also Brazil from Americas are very promising. They initiated discussion with the government, maybe 2 or 3 years back, to have them on board, to have them financing. You heard from Pakistan, millions of US dollars are currently going into the elimination part. They are on track. Saudi Arabia was there, they are on track of elimination. Egypt was there, they are on track. So we have this sort of handful of champions that are willing to help others. And that is the aim we also had through the conference. Let these governments meet, to have them talk together. And as Egypt announced in the end of the conference, we want to support and help in Africa as a region, not one specific country, but as a region. That is a great initiative, I think, from one country who has been leading on financing the elimination part themselves from within the country. No, I think we will follow up the development from the experience of the first round of call for proposal that we successfully concluded in the end of 22. That's a 3-year cycle. That was distributed between different partners in Africa, Asia, and Americas. And all these countries have done very successful programming in different ways, like research, like test and diagnosis, like preventing mother-to-child transmission, vaccination, all these initiatives that's needed in the specific country that we worked in. And that is the opportunity you have. And then you see in that combination of working under the National Health Plan, the government picks up and put a line in the budget and make and spend money themselves for the elimination. And that is, I think, the key to success here. It's seed funding from the Hepatitis Fund and their donors, and then it goes into a country which has that interest and capacity to increase on the seed funding. Low and middle income country, so both sort of status are supported, and of course the interest from ourselves is to raise resources to be able to turn around and give grants. So that is what the receiving end in the room today could listen to and hear, that we have all these partners and we have this opportunity. And that is, yes, absolutely the one to take home, but also to go home and be ready, you know, to develop your own plan, to have activities and push. As you see, many of these doctors that worked in Ministry of Public Health have great ideas and great opportunity to fight for that your government locally, regionally and centrally will prioritize elimination of viral hepatitis.
Global Fund Hepatitis Strategy is aimed at assisting low-income countries to meet the 2030 WHO target endorsed by all member states to reduce new hepatitis infections by 90% and deaths by 65% between 2016 and 2030. Nigeria was recognized for being on track with her hepatitis response at the Geneva Conference. Nasarawa State, North Central Nigeria, took the center stage at the conference. We engaged Nasarawa State Deputy Governor Dr. Emmanuel Akabi on this success story.
In Nasarawa State, we have a really very high prevalence rate of hepatitis, particularly hepatitis C. And from the data we have, the prevalence in Nasarawa State is about 13.2%, while the national average is about 1.1%. So you can see that we really have a big burden of hepatitis C in Nasarawa State. And that necessitated our going to action to see what we do about curbing it and possibly eliminating it. When we came in 2019, we were confronted with this burden of hepatitis C. And His Excellency, the Governor, became quite concerned about it. And a marching order was given to see what they can do about that. And there was therefore a need to now develop a plan on how to tackle this scourge. And thank God that we had the support of the Clinton Health Access Initiative Child. And they came in to lend a helping hand to us in the state in preparing the documents that will help us in eliminating this disease. And together we now constituted a technical working group in the state. And the technical working group went into action to ensure that we eliminate the disease or cure those who have, and also to plan wisely, and of course to stop new infections. And in so doing, we also categorize it into issues of mobilization, getting resources. Where do we get the resources? From the state, from our partners. How do we then manage the disease? Issue of treatment, and then the commodities. How do we get them? How do we store them? How do we move them? And of course, at the end of the day, we make sure that we prevent new infections, and of course, sensitization of the people, so that people become aware of this scourge. And because of the resources that we had, or we have, are very minimal resources, and there's so many diseases competing for these little resources that we have, we then have to prioritize. And of course, hepatitis C management became a priority for us in the state. And also thought that we can use what we have, leveraging on what we have, to see how we can manage this disease so that we don't have to reinvent the wheel. And so that takes us issues of diagnosis. And we thought that the best thing to do is, because we know that this hepatitis C is a co-infection, that people with HIV are more prone to having hepatitis C. Because if you look at it, the causes of infections of HIV and hepatitis C are similar. So we now prioritize patients living with HIV. And that is what we did. And the facilities we have for diagnosing HIV and doing viral load testing and what have you, we're using the same system to also check the viral load in patients with hepatitis C. So we didn't have to buy new equipment or anything new. All we need to do was to reprogram the machines such that they can be used for diagnosis and, of course, the management of this case, particularly in checking the viral load. We have about, all our clinics or facilities in the state, because we designated one secondary facility in every local government for management of HIV. Those are the ones of ARVs. And of all the patients that were accessing ARVs, we found we have registered about 16,243 or thereabout within the state. Out of these, we now were able to test 14,000 of them. Out of these 14,000, we found that 13.2% of them were found to be positive for hepatitis C. Political will is there. The governor is in the forefront of it, and luckily I happen to be a medical doctor, so it becomes a lot easier for us to understand this. And we've made budget provisions in our budget in the states for the fight against hepatitis C. Last year we were able to commit not much, but at least it's better that we started doing something. We committed some funds into the fight against hepatitis C last year. Not only was it in the budget, it was released. It's one thing to have it in the budget, it's another thing to have the finances released. And we released them. And this year, the same thing, much higher amount as budgeted this year. Again, the fight against hepatitis C in the state. And the technical working group meets at least once every 3 months to review what is happening in the state. And already we've put in some people under treatment. And I think, and again, about a year ago, I led a team to Egypt. We met with some guys in Fako in Egypt, still on this hepatitis C, to see how we can collaborate. I think most importantly is to be able to sensitize the states and let them know that we have a disease burden that is here with us. And it's a time bomb waiting to explode. And it's a disease that can be cured and can be eliminated. And of course, the effect on the economy is enormous. Because once it hits you, of course, hepatitis is inflammation of the liver. It hits your liver, damages your liver. Liver becomes fibrosed, or we call cirrhosis of the liver. Then can transform into a cancer. And that is it. If you're not detected early, the guy is gone. We must put this on the front burner. I think that the federal government should come in and see how they can get all the states together on a round table. And the policy formulators must be well educated on this so that together we can develop a strategy that will apply across the country.
Kudos to Nasarawa State for doing the nation proud. Eliminating hepatitis by 2030 is indeed achievable with the right financial and political commitments. That does it on this episode of Global Health Digest. I am Uche Ugochukwu. As always, take responsibility for your health. Until we come away with another educating episode next week, stay healthy, stay safe. I now leave you with these tidbits.